Or do you want to do it? Do you?
We get recorded. That's good. I don't know if we got anybody here. 22 people. Hello, hello, everybody. Let me pop up my chat. Couple minutes early. Couple minutes early here. Good morning, everybody. Good morning, good morning, good morning. Oh, Andrew Bala. Oh, it's an honor, an honor. I've got the morning with Andrew. Cassandra, hello, hello. Martine, hello. Sir, yes, yes, I'm definitely a sir. Nahi, good morning. Jen, good morning. Andrew, do you have from Brent Bishop? Awesome, fantastic. We appreciate that. And I will turn this music off eventually. It's just my pump up music. Good morning. Andrew, is Charlene, the lovely Charlene, with you? Okay, let me cut the music here. All right, we've got another. Oh, excellent, excellent. All right, for the people who are here as we're waiting. Oh, it's 10 o'clock. Let's get started. So I'd like a word about how you're feeling today in one word. One word, how you're feeling today in one word. Oh, we got a sleepy, a sore, an awesome, a hungry, a focused, a snowy, restricted, excited. Oh, capital excited with an exclamation mark. All right, we got lots of different things here. Energized, excited. I'm gonna start the day with telling you a little bit about my day so far. So it's up about 4:30 this morning. Got into work just after 5. It was pretty productive morning this morning. Then had a quick little meeting this morning with Ben McDonald, our education director, who helped me out with some things for Zoom, figuring out how to share some videos. And then after that, we had a quick little sprint meeting with Ben and Andrew. Andrew's our CEO. Andrew makes everything work for us within the online space because we are launching our DTS Level 1 online. So there's quite a bit of work being put into that. We are running our first beta this week, and we'll be launching that a little bit later on. And then I had a morning math tutor session with my daughter, a quick little 40-minute session with her while I was jumping in and out of the shower, and then 10 minutes of playtime with my son, who is 2 years and I guess 4 months now. And yeah, he was spitting all over my face and then rubbing it with his tongue. It was awesome. not COVID-19 safe at all. And then had a nice power walk back up here to the office to do this this webinar. And the power walk was like the swinging, the real swinging of the arms. So it's been a very good morning. So our goal for today is to build a little bit on talking about low back. We did a initial low back last week. And for any of you who have not seen the webinar, you can go to, and I'll type this right in, dtsvips.com. It's in the chat. That is where all our webinars are living right now. They will be moved over to our resource section on the website in the next couple of days. So today we're going to talk a little bit about 3 exercises. 3 exercises that can be not helpful for someone with low back pain. And I always want to be careful when we talk about an exercise that's not helpful. Inherently, all exercise is good. However, if the person doesn't have the capacity, or if they're dealing with a back pain issue, sometimes the exercise can be harmful to that individual. And for any of you who were on webinar number 1, Dr. McGill says that about 50% of the low back pain patients that he sees, he believes that their injury was caused by the trainer or the strength coach. simply because they didn't have an understanding of what the capacity of that individual was. So remember, whenever we put or prescribe an exercise, we place a demand on the client. As a trainer, the key thing that we have to know is what is that client's current capacity. And when you have someone who's dealing with low back pain, their capacity will be reduced, and their capacity for certain exercises will be reduced. So we always start off with 3 questions. So who remembers the 3 key questions from the webinar last week? Question number 1, let me see it in the chat. Question number 1, and for anyone who wasn't on the webinar last week, again, if you go to dtsvips.com, that will give you access to all the webinars. Fantastic. Lots of people are weighing in here. Good days and bad days. That is the first thing we always ask the client. Do you have good days and bad days? And if someone only has bad days, if they only have bad days, they're probably a good candidate for what? Someone put the answer in. If they only have bad days, surgery. You guys, referral surgery. So 100%, I would refer them out if they only have bad days. And if anything that you're doing is not working, they may be that percentage of people who will benefit from surgery. Great. Love the answers, love the focus. If the person does have good days, right away that says to you as a trainer, you've got good days, I can probably help you out. And there's 3 things that we're going to look at when we can help them out. But before we get to those 3 things, we need to figure out the things that, if someone wants to answer, the things that trigger the, Gabriella, thank you for jumping on that. So first thing that we have to figure out is the things that cause the pain. And then on the flip side, Elaine, you're right on it. Thank you very much. You guys are on it this morning. It would be the things that make them feel better. So if we return to our key 3 questions, good days and bad days, once the person says they have good days, then we need to know what can we do to make them feel better, and we need to take away what makes them feel worse. And someone already said the 3 key things that we look at. The initials of those 3 things are P, M, and L. P, M, and L. No problem, Martine. She already wrote it. Postures, motions, and loads. So when we're dealing with someone who has non-specific chronic lower back pain, it's not non-specific. There's always a cause, and that cause comes to postures, motions, and loads. And just as a quick review, the posture can be, a lot of you are on your computer right now. If I'm sitting like this, I'm sitting in a flexion posture. If I move with a flexion posture, meaning I pick things up in this flexion posture, and I load by picking up loads in that posture, the posture of flexion, the movement of flexion, and the loading of flexion can be a pain driver for me. And that would make me flexion intolerant. So if I'm flexion intolerant, can you think of some exercises that would potentially drive my back pain? Potentially drive my back pain. I want to see in the chat here, something that could potentially drive it. A few people are already weighing in. Sit-ups and crunches. So right away, we could make an argument for certain types of sit-ups and crunches. But if we know someone is flexion intolerant, what ends up happening is if you prescribe that person crunches or sit-ups because they've been told they've got low back pain and they need to improve their core strength, the default when people hear core strength sometimes is crunches and sit-ups. I know the trainers, you're a little bit more savvy with your knowledge of that, but for the lay person, when they hear core strengthening, they tend to default to this idea of crunches and sit-ups. For someone who's flexion intolerant, the crunches and sit-ups will replicate the posture, the motion, and the load on the spine that drives their pain. So that's where I would start. Some of you have written deadlifts. The deadlift will depend on the technique that the individual is doing. If they use a flexion posture or flex their back as they deadlift, what is going to happen with that individual is that may drive their pain if they're flexion intolerant. Okay, are we all clear on that? And I want to always use this caveat. If someone is flexion intolerant and you do a sit-up, or there's a lot of rounding in your back as you do a deadlift, that is the pain. That's a driver. That's a posture and motion that drives their pain. If someone is not flexion intolerant, then they can tolerate flexion exercises. So sometimes we get these dogmatic arguments about saying, Dr. McGill says, flexing the spine is dangerous. He's not saying flexing the spine is dangerous. He's saying that the mechanism behind a disc herniation and the mechanism behind someone who's flexion intolerant is spinal flexion. So if it hurts, you don't do it. If you've broken your foot and you go for a run, it will hurt your foot when you run. Running isn't bad, but at that time, running with a broken foot, it doesn't fit. So let's all be clear on where we're weighing in here. I'm not saying spinal flexion is bad. You should be able to move your spine through all the ranges of motion. What happens is when spine flexion drives your pain, you want to stay away from certain exercises like a sit-up. There's another exercise that's quite popular. It's used in gymnastics. It's called a Jefferson curl-up, and I'll show you a picture of what that looks like. And it would be another exercise that I would say for someone who's flexion intolerant, it's not something you should do. So let me just pull that particular exercise up for you. And I'm going to be going back and forth into our low back module, everyone. So we've got our low back module. I just need to be able to see it here. It's disappearing on my screen. So that's our webinars here. And I'm going to just exit out for a second because as I've gone into this, my toolbar has disappeared. So when I share my screen, I'm going to just share a portion of my screen so I can actually see the toolbar here. Okay. So let me move it over. There we go. It just popped out. It was hidden away. So this would be an example of a Jefferson curl.
I have a question for you. I'm going to do this exercise. It's called a Jefferson curl, and I want your feedback. Good exercise or bad exercise? Well, it depends.
So I've taken that right from our low back specialist. That's one of the modules. So what is the answer to that Jefferson curl? Are we all clear? Is it a bad exercise? If you're a gymnast and you're looking to improve your hollow rock, if you are a professional diver, if you're a CrossFit competitor who has to do toes to the bar for your exercises, well, that's probably going to be a good exercise option to improve those movements. If you are someone who has flexion-driven low back pain, then it's not going to be beneficial to you. Another common exercise that we see prescribed is something called a Pallof press. And I'm going to share my screen again and show you a short video again from our low back specialist module. And you can see what that exercise, again, it's not a bad exercise. But for someone who doesn't tolerate shear very well, it can be something that actually drives their pain. And I've seen several people prescribe that exercise who have low back pain. We like the exercise. We just don't like the exercise for someone who struggles a little bit with low back pain, especially if they've got a little spine instability. So let's take a look at that particular exercise for the Pallof press. And again, I'm just scrolling through one of our modules here, and I'll play it for you.
When we're talking about people with chronic, non-specific low back pain, there's certain exercises I would avoid. One of those exercises is the Pallof press. We like this exercise. Let's be clear, we like this exercise, but we don't like it for someone who cannot tolerate shear. When I talk about shear, picture two vertebrae. Shear is when they get pulled apart this way. When they get pulled apart, it can create a little compression on the nerve and generate some low back pain. So a pay-off press looks like this. Generally it's a cable column, and you're taking the load out here, and the person has to resist that load doing that, which is the exact mechanism of shear. So for chronic non-specific low back pain, work on the stability strategy, engineer out the micro movements before you add in the pay-off press.
Another exercise that I see, so we've got a couple where we don't want to use the pay-off press, we don't want to use sit-ups or crunches, and we don't want to use a Jefferson curl for someone who's flexion intolerant. So if you are dealing with clients who sit for the majority of their day, if when you're testing them and assessing them, you identify that they have some flexion intolerance, and if you're not clear on how to test for flexion intolerance, there's a few resources. There's Dr. McGill's Low Back Mechanic book. If you go online, Dr. McGill has done probably at least a dozen or so podcasts that you can watch him talking about that. And then we also have our low back specialist resource. I don't know where you stand right now from a resource standpoint. The lowest cost option that you have is watching all of his webinars online. Lots of them are on YouTube. I think it's an excellent strategy. You can go to our resources section. We have multiple webinars or podcasts, I should say, with some low back experts, including this lady right here, Catherine Raymond. She's the author of this book, Crooked. She's not a back pain expert. It's just her journey dealing with back pain. We have an article on our resources section. All of those are free resources. And then the lowest cost would be the Low Back Mechanic book by Dr. McGill. And then we have our low back specialist course that we are currently offering at 50% off. So it works out to about $300. And you can pay 99 bucks a month. So I don't know where everyone sits. We're all in different financial situations due to the current situation. So pick the one that's most applicable to you. All right, so we have an idea around for someone who is flexion intolerant, things we would eliminate. For someone who is extension intolerant, when they extend their back, it causes some discomfort. Can anyone think of a common low back rehab exercise that actually puts people into extension? Can you weigh in on the chat for me about that exercise? We're exercise professionals. Someone got it right away. The Superman or Cobra, they're essentially the same exercise. So a Superman or Cobra, and because we have mostly exercise professionals, you all know what that is. It's laying on the ground and essentially arching your low back by bringing your chest off the ground. And they call it the Cobra position because it kind of looks like a Cobra, or a Superman in his flying position. If you are extension intolerant, that exercise is the posture and motion which loads your spine in extension. It's the exact mechanism that drives the pain. So we always have to be careful that we understand what posture, motion, and load drives the pain to make sure that we don't give them an exercise that replicates that. So that's the only issue that we run into sometimes with this idea of corrective exercises. The correction has to be for that individual. It has to be personalized to that individual, and you have to understand what posture, motion, and load drives their pain. So as you start to make exercise choices for that individual, are the choices that you're making going to help the individual? Are they going to put them into the posture, motion, or load that drives the pain? So for extension, I would always be very careful with Supermans, Cobras, something else that can be bothersome. You see athletically, sometimes people are doing overhead medicine ball tosses, putting them into full extension. You see them doing box jumps, which is encourage extension. So if extension drives the pain, look at the exercise and says, okay, primarily, what drives this movement? And if you see that it's primarily a triple extension ankles, knees, and hips, but your client has a habit of using their low back, right away you know, hey, this is something that I shouldn't be doing. If you'd like a little bonus, everybody, a little bonus, if you are working with athletes, an easy way to see if someone uses back extension rather than hip extension is you have them jump as high as they can. The person who's using hip extension will go straight up and down. The person who uses back extension, when they jump, they will always go forward. So one more time, hip extension, when they jump high, they'll go straight up and down. They'll essentially land in the same spot. If they use their back, when they jump, because they're using their back, it will propel them forward. So it's an easy little test for your client to know if they're using hips or lower back for extension. And that's something that you can do with athletes. So just check them, see, hey, what is a strategy that they're using? Jump up and down for me. If they tend to jump forward, you know, hey, okay, I got it. You're using your back. Final exercise that we will touch on in this brief webinar is the split squat exercise. Some people call a split squat a stationary lunge. The main issue we get into the split squat with the split squat or stationary lunge is the SI joint, the amount of movement we get at the SI joint. I'm going to share my screen again, and I'm going to have Dr. McGill speak specifically to the issues that come up if we are doing heavy split squats or split squats where we have a very long stance. So I'll share my screen and we can hear again from our low back specialist module.
I hear a lot of people talk about I have SI joint pain. Can you touch on that a little bit and maybe some of the exercises that you, in your experience, really irritate or make that worse?
Yes. Well, of the patients referred to us with SI joint pain, more often than not, they do not have SI joint pain. It's actually a referred pain from something going on in a nerve root in their lumbar spine that passes behind the SI joints and behind the hip. So they are perceiving it as SI joint pain. But we still see patients with true SI joint pain. This is called the pelvic ring. So we have the two ilia, and there's actually an articulation at the pubis symphysis and at the two SI joints at the back. And you can see those micro movements. We see the SI joints here and here. I can move them, see the little micro movements here, and then you see the micro movements occurring right there. And that's what's causing pain. But in order to get the micro movement, I can either compress the iliac crests or compress the greater trochanters. That's one type of micro movement. But the more common one is a mutation, as one iliac wing goes anterior and the other goes posteriorly. What I'm mimicking is a split squat. So if you could stand up, Kevin, I'll just demonstrate those two things. So if you can perform a split squat, which can be a wonderful exercise. We're mobilizing the hips, we're creating balance. Just perform the split squat. Perfect, and come back up. So it's quite a loaded challenge of mobility. But now we get into the question of volume. There are some trainers who will now load this. They might add very heavy kettlebells to each hand, thinking that more load is better. What happens with that is your left ilia was mutating anteriorly and the right one was mutating posteriorly. If you keep doing that excessively, you'll create a laxity and you will actually start to compromise the connective tissue across the SI joint, so that a minor motion, just walking upstairs, for example, now becomes painful. So that would be a test of true SI joint pain versus, oh, I feel it in my SI joints when I sit working at the computer. No, the chances are that will be a neural pathway to what's perceived as an SI joint pain.
So the split squat exercise, not necessarily a bad exercise. but an exercise that when you load it excessively can really cause some issues.
It's been the same theme all the way through this. There really isn't a bad exercise. There's just ones where the volume of training is not respecting the biological capacity of that person. Be a bit conservative on the split squats. Know what your goal is, choose the right tool, and prescribe it in a volume that is within that person's capacity. That volume is changing, and it's not a bad exercise, but it's bad the way some trainers think more is better.
Okay, there we have it, and I'll just collapse this. So that's this is a low back solutions module. We've got 3 of them. There's some case studies, a little bit of Eldoa, some different compression techniques here. This particular model here is all anatomy. And in this model is our low back detective, where we get into all the different, you can see it, assessing loaded tolerance, assessing flexion, extension, sciatica, stenosis, et cetera, et cetera. Again, we want to make sure that we stay within scope of practice for all of those, but it's quite detailed, and all that material comes from the low back mechanic. This is all driven by Dr. McGill. He's a fantastic clinician. What we've just done is distilled it down into this low back specialist module in a way that trainers can use. So I recommend that you check all of his resources, as I said earlier. A summary of what we learned today. For someone who is flexion intolerant, meaning the posture of flexion, sitting, driving in a car, the motion of flexion and loading flexion causes them some pain. Can you give me one or 2 exercises? We were supposed to talk about 3 exercises today. We really talked about 5. In the chat, can you tell me 1 or 2 of exercises you would avoid for someone who has flexion-driven pain? Jefferson curls and crunches, crunch, Palloff press. Excellent, excellent. We've got the idea. They're not bad exercises. In fact, McGill has a McGill curl up. It's a very limited curl up. You can see if you Google that, the McGill curl up, McGill curl up, there'll be tons of them online, but he limits the motion. It's only about 15 degrees or so of movement. For someone who's extension intolerant, what would an exercise be that drives their pain a little bit? Extension intolerant, give me 1 or 2. Cobras, box jumps where they're jumping. And for the bonus, everybody, how do we know if you're giving someone box jumps that they drive their jump through the low back versus the hips? What's an easy way? We have them jump up and down. And if they jump forward, we know that they're using their back. If they jump up and down, it's all hip extension. Awesome, you guys you're on it. So final one, the split squat or stationary lunge exercise. If someone is complaining about or think that they have a little bit of SI joint pain, would this exercise be correct or would it be contraindicated? So for anyone who has a little bit of SI joint pain, or they say they've got SI issues, it would be contraindicated. Can anyone tell me why? The SI joint, is the SI joint supposed to have a lot of mobility, or is it more about stability? Is it a stiffer joint? Tell me which one in the chat. Everyone's got it. Stiffer, stability. The SI joint transfer power from the legs up into the torso. So we want a bit of stiffness at that SI joint. So all of you can picture if we're doing a split squat and we're getting that nutation and counter nutation, we can actually make that joint a little bit lax. So we have to be careful. If we do prescribe the split squat, should the stance be short or super long? Should it be shorter or longer? Pick the word, shorter or longer. Perfect. And should we have a high volume of reps or a lower volume of reps? Perfect. And we would build up that capacity over time. All right. So quick summary, one more time. We asked the 3 questions: good days or bad days? What drives the pain? What takes away the pain? That's all covered in webinar 1. Now, when we're working with the client, we always want to make sure we're looking at postures, motions, and loads. For someone who's flexion intolerant, we want to avoid exercises like the crunch or curl up, a Jefferson curl, a pale off press potentially. For someone who's extension intolerant, we want to avoid exercises like a cobra, Superman, doing things like box jumps that encourage that same motion. And then finally, if someone is experiencing some SI joint issues, when we start putting people into a split squat or stationary lunge stance, that's something that we want to be careful of, and we want to reduce the length of the stride, and we want to reduce the volume of the number of repetitions that we're doing. So there you have it, a few exercise considerations. We'll be back again on next Wednesday, and we'll be talking about another topic with regards to low back pain. I would like all of you to stay safe. Please make use of this time. Learn about low back pain. Whether it's yourself or your clients, you are going to be dealing with people with low back pain on a regular basis. So build some competency around understanding good days and bad days, what drives the pain, what takes away the pain, and then looking at your exercise selection to make sure that you are not replicating the postures, motions that potentially replicate the pain. Trainers, posture, motion, and load is in your lane. You have the potential to be this beacon of light and to give people hope. So please make sure you educate yourself on the protocols for dealing with clients with low back. Okay, thanks everyone. Really appreciate your time. If anybody has any questions, I will be available by phone for the next half an hour. I'm actually going to write my phone number here. If you have a specific question that you would like to ask me, the only thing I ask is no text, just a phone number. I'm old school, phone. So I will be available for the next half an hour if anyone has some questions where they would like to reach out to me personally. Okay, if not, I also will provide you with my email if there's any questions that I can address. I just always ask you to give me some time to get back to people with email. It takes me a little bit of a time to clear them. All right, have a wonderful day, everyone. Stay strong.